Hello, viewers. Welcome to the Voice Show that happens here at Science TV. I am your host, Vidalis Njoki, and that is my signing. Don't forget, the Voice Show always airs every Friday at 8 p.m. and there is a repeat show every Sunday at 3 p.m. Also, if you want to know more about us, you can go to our YouTube channel and search The Voice Show. So please leave your comments, like, and subscribe as well as share. And anytime we have any show, you are notified. So today I have a gentleman here at the set with me. So I want you to feel very welcome. Please introduce yourself and tell us what you do.
My name is Ashley. I'm part of the mental health and safeguarding team. I have been working in the mental health space as a mental health nurse, or what they understand as psychiatric nurse here in Kenya. I've had several years of training, which I started training in Scotland, honed my skills in England, and I'm now here with Pamoja to share those skills and knowledge in Kenya. I'm from Zimbabwe, but Pan-African.
Oh, wow. I love how you have traveled to various countries from Zimbabwe in Africa. Then you went to two places, Scotland and the UK, to learn more about the mental health. So can you tell us specifically how is it? Because as a student, how did you decide to focus on mental health?
So, having grown up in a family of caregivers at even just a basic care level of looking after our own elderly people, we don't have care homes to send them just to like what they have in the West. So having a family that demonstrated caregiving, and me being the eldest of my cousins, I used to look after them, especially when we all met up for family gatherings. I tended to be the head boy in charge of looking after them, and they would start telling me some of the problems that are happening at their own homes and confide in me. And I think moving forward, that kind of now led this desire for me to build up the skills and knowledge on a professional level, to be able to support others who will need a level of support whenever they're faced with mental health challenges.
That is really interesting. So it started from deep in your heart. So you saw the gap, and then you became the head, and then they could confide in you.
Yes.
So you were a safe space for them. So to bring the African perspective on mental health,
Yes.
it's not very welcoming. So can you share some of the misconceptions that we have about mental health around men? Because we are in a world, yes, we have developed, but about mental health and how it affects women, that is advanced a bit compared to men. So can you share some misconceptions around men?
Okay. So, with my background, family-wise, I did witness situations where some of the elder males in the family felt under pressure whether it was work related or family life in terms of their relationships, and trying to juggle these many hats, which tends to be what a man is supposed to do according to the societal norms. You have to bear all these burdens and not really show any signs of feeling overwhelmed. And so I realized that there is a lot of stigma for men to come into open spaces and talk about their issues quite openly and feel confident enough that the person they're sharing this information will hold it in the highest of confidentiality. So this is something that, as a team with Pamoja, we're trying to raise that awareness that, you know, for men, it's okay not to be okay. And seeking help is not a sign of weakness, but it's actually a strength. And it just creates a better community and a better environment. Families thrive, companies thrive, productivity goes up when the workforce is in a healthy state of mind. And I think we need to shift away from certain viewpoints of seeing mental health problems as either being bewitched or something that is a possession by a demon, or you see, those kind of concepts have created more barriers rather than create an open platform for people to discuss issues.
I really agree. It's very sad how people spread the misconceptions about mental health, especially related to men. Some people believe that men must become the head of the house. They should be okay at all times. They should show that they're strong. If they cry, it's a sign of weakness. And sometimes it's not really okay. So we've seen cases where there's a place in Juja who jumped on the highway to get knocked down by a car. So there's an increase of cases of suicide among men. And then they don't know where to report exactly about this. It is not justified, meaning that it's the right of certain people to get and not for the others. So what are some of the challenges that men experience? So can you advise some of the men and where to get help and to create awareness? Also, some of the contribution we as a society can make to accommodate men who are struggling with mental health. Okay,
very good question. And I'll try to break it down very well. So you find that I think the starting point for any group, whether it's men, women, children, we have to start with raising the awareness of what mental health is, what can be done to improve our state of well-being. So this is what Pamoja has tried coming in to do, into going into schools so that we support children and empower them at an early age to have the skills to spot the signs and symptoms and be able to seek help at an early stage before it goes into the crisis stage. So that's basically Pamoja's kind of prevention model, really. And we also look at it from then the adult perspective, is that those children have parents. Parents need to be given the awareness of what the mental health means, and what, you know, once we start raising awareness with more groups collaborating and raising, you know, the level of understanding that these challenges can be actually solved, or we can prevent people from the point where they end up committing suicide. Recently, I read in Kenya, I think there's 4 suicides per day.
Oh.
And that's quite high. So, really, if we start empowering people from an early age and creating platforms where it's okay to go and seek help, as I mentioned, because your mental health is the driver of everything. The brain is what sends messages to all the other organs to perform. So if we don't look after the brain, then we're leaving ourselves vulnerable to our other organs from not performing as they should. So it should be at the forefront. And for men, I would encourage, as I say, to seek help, speak to peers that you trust, that you know can hold information confidently. Be there for one another. Women tend to look out for each other very well. They have it. But the men, I think, withdraw into our shells like a tortoise. And we forget that, we should be able to reach out. So I think that's the first message, really, that I will always say. There is always a confidant within a family unit or a friendship circle that is willing to assist. So we are going into companies as well with Pamoja to speak about creating a workplace environment that is going to allow people to be able to feel that they can express their challenges without feeling, judged and feeling that they are no longer useful for the company or the organization. So it's creating that culture of openness and investing in your team. And we're going in to deliver training to even the leaders to shape their human resource policies and safeguarding policies within the workplace. And my CEO, Faith, she's Kenyan. She's very much a champion for safeguarding.
Wow. It is very sad to see approaching the end where we need to change the system and to fill the gaps within the system. And to have a support system is very important. I want to say first, 4 people in one day committing suicide is a very high number. And there's a very big gap, meaning that there is a lot of work to be done.
Yes.
You see, we need to create a safe space where people can go and express themselves. Also, do you think social media is contributing to mental illnesses? And if it is safe for men?
Yes, you're very right with regards to the social media, which initially was a very useful tool, but we are now starting to see a lot of detrimental aspects that are coming with it. So, for example, the amount of screen time people are using has an impact on the sleep, because we talk about the UV light and the blue light as well that you get from all these devices. This starts to reduce the amount of time that you rest your brain. And when you don't have enough time to rest, you start to decline in terms of your motivation, concentration levels, appetite. You're quick to become irritable and not relate to others in a very productive way. So I think the amount of time has to be something that we really could look at when it comes to social media use. And then we're also having some unregulated social media platforms where very horrific images and videos are being broadcasted without restriction. And some of them are sensitive in terms of age, and also some of these horrific images are just too traumatic to see. So we have to sort of look at how we can safeguard children, safeguard families, parents from these images, which once you've seen it, you can't unsee it. So it just happens that for men, I think we tend to self-diagnose and we look at a lot of information online and we speak to our body and say, what do you think could be the problem? Have you tried using this medication or that medication before? So when we rely on such information, which is on social media platforms, on the internet, you don't know who put it out there. Sometimes anyone who's not a professional can put information out there. So you have to really seek professional help on a one-to-one level whenever you can make it, so that you get accurate support and clear diagnosis, which is what you have consultants, psychiatrists are there for. But I think, the social media, we really, really have to be careful how we use that. I think for men as well, we tend to maybe withdraw and spend more time on social media and use that as a distraction to disconnect from other avenues where we could have productive support systems to access. So we mustn't forget that, sometimes you have to put that phone down and actually think, all right, who can I contact or where can I go to seek help?
Wow. Social media contribution, it has positives and negatives, and it's good to hear from you. So we are going to have a commercial break. We'll be back with a discussion about mental health. Welcome back. Let's continue with our talk with Ashley. Mental health. On mental health, it's nice to see that we have very different perspectives. We have talked about the negatives. So I'd like to ask you to share with us. You said you work with Pamoja, the organization. Can you share with us what you offer for mental health for any person who is looking for help with things related with mental health?
Okay, thank you for having me back on. So with Pamoja, what we have looked at is reports that were prepared by the Ministry of Health, and they obviously inform that 75% of Kenyans lack access to mental health services. And so that led my CEO, Faith, to think about giving back to her country of origin. And it was an easy decision to make when she invited me to be part of Pamoja. So we're here now based in Kenya, and our aim is really to upskill those frontline workers like nurses, to be able to spot the signs, be able to intervene at an early stage. We understand that, yes, they have general health training first and then specialize in mental health. So we want to just enhance that, or just do some collaborative understanding of creating a better outcome for patients, really. That's the ultimate goal. And then I think you heard from my colleagues in terms of how the accessibility of mental health services for the disabled. And I think there needs to be some delivery in terms of skilling frontline workers again with, Kenya Sign Language, so that when people are imparting very personal experiences, there isn't a third party who might make them feel a little bit more withdrawn and not open up as much because they're worried about the confidentiality aspect. So as Pamoja, we look at, increasing that understanding that we need to create confidential spaces. We really need to safeguard information and protect the data we are given by individuals and hold it with a high regard. And we're also looking at, as I mentioned earlier, going into the companies so that we inform companies on how to create a workplace that is safe for all. And I think if you look at the Kenya, it's called the Kenya Equality, it's the Constitution, Kenyan Constitution 2010, which Article 27 really focuses on the aspect of equality, so that there's no lack of access to safety, security based on gender, age, disability, you name it. So when you see such laws as well being in place, this does create a community and a nation that is going to be a safe place for all to be able to access education, healthcare, you name it. So I think as well, what we want to do is partner with other organizations to raise the level of awareness. And it's a pleasure to be on this platform that you invited us, to be able to reach out to your audience and encourage them to get in touch with us. We might not have all the answers, but at least that first step of reaching out is always the best, because from then we can start to make headway. And as my CEO said, we tembee pamoja.
Wow, it is really interesting. I hope the viewers have understood clearly where you can go for the services. So the final question. It's not final, but we are going to stop there for now.
Yeah, that's fine.
Do we have any policy that Pamoja wants to advocate for, or any policy development that can help reduce suicide, mental illnesses? Do you have a better platform where you can advocate that people go to access the services? And how do you make sure that any person who accesses these services does not feel marginalized or left out?
Okay. Again, another brilliant question. So what Pamoja we've looked at is one of our strengths is that we come from a mental health and safeguarding standpoint. It's a combination of mental health nurses, occupational therapy, with a multidisciplinary approach. And our CEO, she's got her level 4 safeguarding training, which is something that is well equipped for her to advise companies, especially human resources departments, on how they can shape their sickness policies, how they can shape their workforce, self-care, and things like that, in terms of how you create an environment where your team feels valued and you remain productive. But informing the leaders within those organizations as well to think about mental health and not always put it on the sidelines. So as there are many avenues to pursue support in Kenya, which are doing some amazing work already. And already we've seen there's quite a number of hospitals where people can go in and access services. There's government and private hospitals. Then also we have an ability for people to get onto our website and book a consultation. So we are on pamojasafeguarding.com, and we have a page where you can book an appointment, and we'll be able to reach out and assist and maybe signpost if there are certain other aspects of someone's mental health care that we need to bring in other professionals into. One strength we have as well is medication management. So we understand that people tend to self-medicate with over-the-counter medication and maybe end up taking the wrong dosages or end up just continuously using a certain drug because they feel it's worked before, but maybe there might have to be another review of that medication for them to get better efficacy from it. So because we've had experience of working with patients who have been on medication for some time, we have built those skills to be able to advise and say, well, these are certain side effects to look out for. If this is becoming too much, then we need to go back to your prescriber and talk to them about maybe reducing that dosage or maybe shifting to a different type of medication with less side effects. So these are things that we're really interested in advising on, so that we just look out for each other and create a healthier community that is thriving.
Welcome back. Let's continue with our talk. We've